Smallpox is an infectious disease characterized by one of two variants, variolar major and variolar minor. The initial symptoms are similar to that of other viral diseases, such as the flu or a fever. Things like headaches, nausea, or muscle pain are also common. After 12 to 15 days of infection, small red lesions will begin to appear. When looking at the origin of smallpox, in 1963, Dr. Charles Conor from the University of Colorado stated that suggestions from the ancient literature indicate that smallpox may have begun in Eastern Asia. It was known to the Chinese for at least 2,000 years. On the basis of its mention in sacred Sanskrit writings, it would appear to have been present in India for thousands of years prior. Finding out how smallpox made its way to France proved to be a difficult task. According to Khan, note was made of smallpox in Syria in 302 AD, and an epidemic is thought to have occurred among Arabic troops during the Elephant War of 569 AD. Spread to Egypt is believed to have taken place in 57 AD. In 622 AD, the disease was spread by the Arabians eastward into Asia Minor. In the 6th century, the Arabs carried the disease to North Africa, where they fought many wars. From there, it appears to have spread southward across Africa. From this insert, it would appear that smallpox survived and made its way to France through migrant travel caused by either war or searching for a better life. A big problem for France and other countries dealing with the epidemic of smallpox was how easily and fast it spread. A report by the World Health Organization stated that smallpox is transmitted from person to person via infected aerosols and air droplets spread in face-to-face contact with an infected person after fever has begun, especially if symptoms include coughing. The disease can also be transmitted by contaminated clothes and bedding, though the risk of infection from this source is much lower. The easily transferred nature of the disease naturally caused the people of France to panic and shun anyone who was infected with the disease. It was just too much of a risk to be around those already infected. Throughout the history of smallpox, it killed as many as 30% of those infected. Between 65 to 80% of survivors were marked with deep pitted scars, which were most prominent on the face.
Smallpox killed an estimated 400,000 people annually during the closing years of the 18th century. In 18th century Europe, a third of all reported cases of blindness were due to smallpox. The effects and symptoms were extremely severe, and because of the severity of the disease on the outside of the body, it made it extremely infectious. Those infected with the virus, 20 to 60% of those died from the disease. Many people tried to make progress on inoculation during the 18th century, but advancements were slow. There were some people who made enormous advancements by taking huge risks in their experiments. One of them was John Jagar. He was a famous British physician born in 1740 and founded rules for the prevention of smallpox in 1793. They were extremely helpful in reducing the death rate and the infectivity of the disease. He wrote 4 rules of prevention for preventing smallpox. His first rule was to never allow someone who had never had smallpox into the house that is infected. Unhealthy people must be isolated immediately. His third rule was to make cleanliness an absolute priority. He wrote that people should clean their entire house and furnishings to minimize the chances of infectivity. When his system was followed, mortality was reduced by about 75%, and he showed that if it was fully observed at all times, the death rate would fall by 97%. His work greatly reduced the risk of infection and possibly saved millions of lives. In 1796, Edward Jenner, a doctor in Berkeley, Gloucestershire, rural England, discovered that immunity to smallpox could be produced by inoculating a person with material from a cowpox lesion. He tested a young boy, James Phipps, and it was a success. Phipps never showed any sign of infection, and even after being exposed to disease, did not ever get the disease. Although the French medical community had not led pro-inoculation efforts in the 1750s, by the 1760s the Corporation of Physicians was perceived as the sole entity capable of persuading the public to inoculate. Inoculation advocates wrote, "The public awaits the competition between the luminaries in the Faculty of Medicine. This decision, without a doubt, put an end to all the disputes that have been raised concerning inoculation."